Raise your hand if you've ever panicked through the thought of a medical procedures. Needles, blood tests, waiting for results, or even stepping into the hospital. These are all things that can cause so much anxiety for all of us. But today, we're going to talk about how to overcome those fears and share some specific tools for managing common fears like needle phobias, blood phobias, and more. Hello, my friends. Welcome back to Your Anxiety Toolkit, where we talk all about how to face your fears, big or small. My name is Kimberley Quinlan. I am a licensed anxiety specialist, and today we're focusing on how to overcome the fear of medical procedures. This was actually a listener's question. We're going to discuss general tips and tools for common fears, including needles, blood, waiting for results, and hospital visits. I'm going to guide you through using a tool we use in treatment called exposure and response prevention to help you manage those fears. So let's get started. Now, before we get going, let me say that this is a topic I feel particularly qualified to talk on. As many of you know, in 2019, I went down a very scary rabbit hole of finding a lesion on the left side of my cerebellum in the back of my brain. And I had to undergo dozens of tests, dozens of specialist appointments, and several hospital visits. It was so scary. It was horrible. And without these specific tools to manage my anxiety, I'm really not sure I could have gotten through it or handled it. My hope today is to give you some helpful tools to manage the fear of medical procedures and then go into depth on a few specific conditions and fears that many of you have and many of my clients have had, such as needle phobias is one big one, and blood phobias. And we'll also talk about managing panic attacks during medical tests as well. So let's look at some general tips first, just to get us started, and we can go from there. Now, when it comes to managing the fear of medical procedures, the first thing I want you to do is compassionately acknowledge your fear. This is going to be like step number one. Before you do anything, let's first recognize the fear of medical procedures is completely normal, whether it's the fear of needles or just stepping into a hospital. Many people experience this anxiety. Now, the key to managing it is to acknowledge your fear. Just acknowledge it. You might have to say things like, yeah, I am afraid, and that's okay. Once you can accept that, you can then start to face it with tools that we will cover today. Now, another very important step is to educate yourself. Remember, knowledge is power. One of the biggest causes of anxiety, especially around medical procedures, is the unknown. Now, as you all know, I am a huge advocate for tolerating uncertainty and willingly kind of bring on the anxiety. But it is okay to ask questions about the procedure and what to expect. You might want to ask questions such as, what will happen during this procedure? That's important to ask. How long will it take? Should I expect a lot of discomfort? Getting educated on what to expect is going to be key. And it is okay to ask your doctor questions until you feel more comfortable, especially with the whole process. Now, that being said, there is one thing I want you to all keep an eye on, which is if you find yourself asking for reassurance over and over and over, that might be a sign that you need to return to your practice of willingly allowing uncertainty to be there. Some education, especially about the condition or the procedure, is completely fine. But we don't want to spend hours reading the internet, looking at articles, Googling the procedure, or trying to figure out everything and figure out the possible catastrophic outcomes. If you have health anxiety, you might want to set some rules for yourself, especially on how many questions you're allowed to ask, specifically the doctor, and you might want to even hold yourself accountable, compassionately, of course. Remember, ruminating doesn't solve anything. It's only going to upset you more. So we want to keep an eye on that. Once you have the appropriate education about the procedure, you will likely still be anxious. I totally get it. I'm one of those people who feels anxious before any procedure. No matter how much education I get, I still have to practice the skill of mindfulness and mindful breathing. When we're anxious, we tend to take shallow breaths, which then tells our brain that something is wrong. So practicing breathing at a normal rate can be very helpful as you anticipate your medical procedure. Don't worry about slow breathing. That actually might freak you out more and get you overthinking breathing. Instead, I just want you to stay mindful of your breath and try to get back to a regular, easy breathing pattern, even if you're really anxious. Mindfulness also involves staying present. Often, when we know we have a medical test or a procedure, we focus on that instead of being present. Now, I want you to bring your attention to the here and now and stay focused on now, not later. It is likely that your brain's going to keep nagging you with thoughts about the upcoming medical test or the blood test or the test results. Your job is to just notice them as thoughts and come back to the present. You might need to practice this over and over and over and over, and that's okay. Just keep trying. It doesn't mean you're doing anything wrong. The other thing you'll need to remember is to allow the anxiety to come with you. It's okay to just let anxiety come. When I had a series of brain MRIs, there is nothing I could do about the anxiety. It was coming no matter what I did. So my solution was just to let it come. I would talk to anxiety as if it were a person. I'd say, oh, hi, anxiety. It's okay that you're coming. We're going to do this MRI together, but you are not in charge and you will not be the focus of my attention. I would kind of like chat to it like it was an annoying friend or something. While I was in the MRI machine, I would just breathe and bring my attention to one focal point. And to be honest, sometimes I would plan my 90th birthday party, or other times I would put my attention on the sounds of the MRI machine. I would just pick one thing and focus on that. If you've ever been in an MRI, it is a wild experience. It was like nothing I had ever experienced before. There were times when I felt like I was going to panic though, and I also just had to let that panic come and go, because you can't move, you can't leave that MRI machine. When you don't fight panic, it doesn't have all that power over you. I just tried to let the panic rise and fall, which it did multiple times. It's going to be so important. And if you want more info on how to manage panic, I have tons of episodes on Your Anxiety Toolkit, so you can check it out there. Now, as you wait for the medical test results, you will have the task of doubling down on these skills. The good news is that you're just going to keep practicing the tools you've already outlined, because as you wait, doubling down on being willing to be uncertain and having anxiety, this is going to be key for you. You're going to have to put your attention not on the results, but on what you value and what matters to you. I know this is hard, but there were times when I had to wait almost 2 whole weeks to get very scary results back. And I've never had to practice my skills as much as I did during those 2 weeks. So each time anxiety waves would come and go, I would just keep reminding myself to be patient, be kind, be mindful, and don't give up. You can actually use this as an opportunity to practice this, and over time it will get easier. Now, if you're specifically afraid of needles, you're definitely not alone. Needle phobia is a common fear, but with the use of exposure and response prevention, there is a highly effective way to work specifically on this issue. And this is how we practice ERP with our clients who have the fear of needles. It's also known as trypanophobia. Now, step 1 is to identify the feared situation. Start by identifying the situation that triggers your fear of needles, whether it's seeing a needle, hearing someone talk about needles, or even imagining an injection. Step 2 is gradual exposure. Begin with small, manageable exposures. This might involve watching videos of injections or looking at pictures of needles. Over time, you can increase the intensity of these exposures, maybe like visiting a doctor's office or even holding a syringe without a needle attached to it. We do these exposures a lot in sessions with our clients, and they're so powerful. We have clean needles at our office, and our clients can practice holding them, looking at them, whatever is needed. And often the people with a needle phobia is also afraid of the pain they will feel. Now, with their permission, we might have them sort of simulate that by maybe holding a paper clip at the area where the needle is going to get put in and practice having the pressure applied in this area. This is really to help them desensitize from the pain that they'll feel. Now, then we're going to practice response prevention. And this is resisting any usual responses, maybe like avoiding the situation, distracting yourself, and instead allow the fear and anxiety. Just notice it, allow it to pass without reacting. And lastly, step 4 is to repeat, repeat, repeat. This will help you build confidence, and you'll start to see that the more you expose yourself to these thoughts or feelings or sensations, the less stressful they'll be. Over time, your brain will learn that the feared situation is not as dangerous as you once thought it was, and it will start to be a little less. Now, of course, do not forget to be as kind as you can, and remember to celebrate yourself as much as you can when you've done any of these exercises. Go out, have ice cream, go to a movie, call your friend and let them know, because you definitely deserve celebrating. So now let's also talk about one other area, which is what to do when we're working with someone with a blood phobia. Blood phobia or hemophobia can be intense, but again, exposure and response prevention can be incredibly helpful in reducing that fear too. Now, here's how to apply ERP for blood phobia. Step 1 would be to, once again, we want to identify your triggers, whether it's the sight of blood, hearing others talk about blood, once again, or even thinking about blood. We want to identify what specifically triggers your fear. Step 2, again, is to practice gradual exposure. You might start by watching short clips of blood, looking at images of small amounts of blood, coloring your skin with red Sharpie. Over time, the increased intensity of these exposures, maybe we might move to watching videos of medical procedures, reading stories about people who give blood. And step 3, again, always, is response prevention. During these exposures, you'll want to notice any anxiety and resist the urge to escape or avoid the situation. Sit with the discomfort and allow your body to naturally have anxiety as it rises and falls. Remember, anxiety is not harmful. The last step is to increase your exposures gradually. Keep building up these exposures and working through them and being in situations where you might encounter blood, like again, during a medical procedure. And by doing these gradually, you will reduce either the intensity or you'll increase your mastery over the fear. Once again, we want to celebrate every bit of hard work you're doing. Bask in the amazing things that you're working through. Okay, sometimes the hardest part isn't the procedure or waiting for the results. It's actually making the appointment. If you're someone who avoids scheduling doctor's visits because of fear, I suggest you break it down into small, manageable steps. First, just set a reminder, or just have a time where you say you're going to pick up the phone. Again, reward yourself for taking that first step. You don't have to go from 0 to being completely comfortable with the appointment making stage. Take it one step at a time. Now, you might also benefit from asking a loved one to help you by sitting with you while you schedule the appointment. Remind yourself that you are stronger than you think, and today, you know I'm going to say it, is a beautiful day to do hard things. You might also use this as an opportunity to practice the exact same skills you're going to use in the appointment. Now, these are not just silly skills. These are skills that you can use in any area of your life. And I have found them to help me in getting through regular life experiences. So the main thing with setting these appointments is just be willing to be really uncomfortable and move into it as fast as you can. Now, if stepping into the hospital is the hardest part for you, we're going to do exactly the same process that we did for needle phobias and blood phobias. If that's hard for you to get into the hospital, the goal is for you to practice visiting the hospital as many times as you can. Now, I would not encourage anyone to wait until they're having a medical procedure or condition to do this. The target here is to visit it as many times as you can when there's no pressure. Even if you just go in and sit in the wait room or even sit in the parking lot of a hospital over and over. If you have a friend who's in the hospital, use it as an opportunity to drop them off a care package or any other way that you can practice facing your fear. Donate things to the hospital. You can also practice using your mindfulness skills. Focus on what you can hear, smell, taste, whatever brings you more present into the moment. Over time, it will get easier. So that's what I want you to practice. You'll see that a lot of these things are very, very similar, right? But they will help you bring clarity and direction so that you can start to feel more confident going to see the doctor. It comes with practice. If this is what you needed, I really encourage you to really review these things. So there you have it, guys. I know that was a lot, but I hope it brought you some clarity and some direction and have a little more confidence with all these practices. With practice, you can overcome the fear of medical procedures, including the fear of needles, blood, waiting for results, scheduling appointments, and even walking into the hospital. Remember, these fears are natural, but they don't have to control you. You have the tools now to face them. And again, as I always say, don't ever forget, today is a beautiful day to do hard things.